How we choose to deal with this emerging health crisis will shape the future generations. Good day, everyone. The COVID-19 pandemic is one of the most dangerous challenges this world has faced in our lifetime. It is above all human crisis with severe health and socio-economic consequences. The World Health Organization, with thousands of its staff, is on the front line, supporting member states and their societies, especially to the most vulnerable among them. With guidance, training, equipment, and concrete life-saving services as they fight the virus. Under the ECQ protocols, the movement of people was severely restricted. Mass public transportation services were suspended, while land, air, and sea travel were restricted. The restrictions included transport network vehicle services. All the establishments were closed except those that provided necessities like supermarkets, convenience stores, hospitals, medical clinics, pharmacies, banks, and food preparation and delivery services and water refilling stations. Government offices, business process outsourcing companies, and export-oriented industries were allowed to operate with its skeletal staff. Work on the private sector went on under work-from-home arrangements. The COVID-19 pandemic is acknowledged to have begun on November 17, year 2019, with the first recorded case of the disease in the city of Wuhan in Hubei province, China. In the following weeks, cases of people infected with the virus piled up. However, the government kept tight lead on health data and even reprimanded the local doctors who warned of the new disease. The Chinese government informed the World Health Organization of the existence of the virus only on December 31, year 2019. Such a lack of transparency prevented health authorities globally from taking preventive action and containing the transmission of the COVID-19 virus across our cities, nations, and borders. We all have been affected by the current COVID-19 pandemic. However, its impact, the pandemic consequences are felt differently depending on our status as individuals and as members of society. While some try to adapt working through online, homeschooling their children, and ordering food via Food Panda, Grab, Maxim, and others have no choice but to be exposed to the virus while keeping our society functioning. Our different social entities and identities and social groups we belong will determine our inclusion within our society and by the extension of our vulnerability to epidemics. This virus is unprecedented in our lifetime, and it requires an unprecedented response. Obviously, in such conditions, it is possible that the same facts have had different readings by different entities. Once we have finally turned the page in this pandemic, there must be a time to look back fully, to understand how such a disease emerged and spread its devastation so quickly across our globe, and how all those people involved reacted to the crisis. The lessons learned will be essential to effectively address similar challenges as they may arise in the future. But now is the time. Now is the time for unity, the international community to work together in solidarity to stop this virus and its shattering consequences. Good day, everyone, and God bless us all.